I'm Michael Hartley. I'm a vascular surgeon with Hamilton Vascular Center. It started out when I was a kid. I have a very minor eye issue that took me to the eye doctor a number of times. And I was fascinated by the technology and by the process of it all. And so by the time I was probably 5 or 6 years old, I thought I wanted to be a doctor. I started at Georgia Tech. I had every intention of, in engineering school. I grew up a fan at Tech, a Tech fan. Georgia Tech at the time had a bioinstrumentation pathway through electrical engineering. So I transferred to Mercer and completed my undergraduate in biomedical engineering at Mercer. Went and got a master's degree in biology at Georgia College in Milledgeville, my hometown, and then went back to Mercer for medical school. Did my clinical years for Mercer in Savannah. Dalton is a unique place. I knew that we wanted to either be in the mountains or we wanted to be by the water, by the ocean. We had lived in Savannah. We had done the kind of by the ocean thing. We thought we'd try the mountains, and came here and just kind of fell in love with Dalton. Hamilton Medical Center is such a unique facility. There are a lot of complex things that we do. Far and away, the two biggest risk factors are smoking and diabetes. And those lead to narrowings and blockage in blood vessels, primarily in the legs. But what's not well understood, or what's not well known, is that venous disease is actually about 6 times more common than arterial disease. But it's incredibly underdiagnosed. What do I mean by venous disease? Venous disease can be something as simple as chronic leg swelling. Patients that have kind of a achiness at the end of the day in their legs. They just feel like their legs don't treat them as well as they used to. They kind of give out a little bit sooner than they did before. It can also, in more severe cases, lead to varicose veins. That is the obvious, or one of the obvious sequelae from having venous insufficiency, but not everybody with a venous insufficiency develops varicose veins. And then you can have the extreme circumstance where people actually get sores on their legs, what we call venous stasis ulcers. But those are incredibly uncommon as well, relatively speaking. So we've got tons of people walking around in the community that have venous disease that don't know it. They just attribute their tired, achy legs at the end of the day to getting older, which is understandable. So that is a part of what we do. So what's the benefit of having a patient to come to Vitruvian for something like vascular care or care in general? As we have grown, and I've seen it in the almost 15 years that I've been here, we've expanded our service line to include an exceptional wound care department, diabetes treatment, rheumatology, cardiothoracic surgery, interventional cardiology, structural cardiology. So we are set up as a system so that if a patient comes, if they happen to come to my office first, which isn't very common, but if they come into the primary care, or they're sent to me, or they're sent to diabetes treatment center, or they're sent wherever for whatever their disease process is. If it's a patient that happens to see their endocrinologist with a diabetes, and they come to our office, then we send them. For us, it happens to be right downstairs from my office to the wound care center for treatment. Did we help somebody? That's always number one. I mean, did what we did today benefit the patient? We have some very sick patients with some very difficult pathology, saving people's legs that have got terrible infections and things. But even in those situations, you go back to, were we able to help this patient so that their life from here forward is going to be better? And if that answer is yes, we had a good day. One of my mentors used to say it's kind of like getting on an airplane. We're on the plane together, we're flying together, and we're going to get through this.